Hello, this is David Holt, RN, IV consultant, giving some tips on how nurses at skilled nursing facilities, post-acutes and such like, usually called SNFs, how they can give a full dose of IV antibiotics. So far I've watched 13 RNs at SNFs give IV antibiotics, and I've yet to see one give a full dose. All of them have left the IV tubing completely full of antibiotic. That stems from the fact that they are all using one IV tubing setup. It's just a mainline IV tubing to which they attach the antibiotic at the top, of course, and to the patient at the bottom, and in between they have a partially intelligent pump, which if you program it correctly with a 2 IV tubing system, you can give a full dose. However, when you're using a 1 IV tubing system, the IV pump will never give a full dose of antibiotics or any other medicine. So, SNF workers, this is what you can do. After hanging your IV antibiotic with that precious 1 tubing because your facility is too lazy or too frugal to order secondary tubing from the pharmacy, which you may need a doctor's order for, but as you only have a 1 tubing setup, you will program the pump to infuse all but about 22 to 25 cc's of the antibiotic in the bag. That way the bag will be empty and you only have to clear the antibiotic which is left in the tubing. In order to do that, of course, you need to do one of 2 things. A, you can replace your empty antibiotic bag with a bag of normal saline or D5W and program your IV pump for about 25 cc's to completely clear the IV tubing of antibiotic. Or you can take the IV tubing out of the pump, and if it's a peripheral IV, you can adjust the flow meter and allow the rest of the antibiotic to free flow at an appropriate speed or rate into your patient until the IV tubing, or rather the antibiotic, is down to the very last few centimeters or inches of the end of the IV tubing, and that way you will have given the entire dose. If the patient has a PICC line, which is quite likely at a SNF, then you may need to do some version of an IV push. In order to do an IV push of IV antibiotics, you would need a separate doctor's order or prescriber's order, because nurses do not get to push unless the prescriber has ordered something to be an IV push. The book 7 IV antibiotic mistakes, which was up at for the first 2 minutes of this video, shows 3 other techniques. It's in chapter 2 for those of you who insist on using a 1 IV tubing system to give these very, very important medications. If you only give half a dose of antibiotics, your patient is unlikely to recover from his subacute bacterial endocarditis or from his osteomyelitis, which is deep in his pelvis, and so he'll come back, or she will come back into the hospital or skilled nursing facility because there'll be remnants of his or her bacteria, and you'll be picking up, lucky you, another 6 weeks of Medicare money and incompetently giving him or her antibiotics for an additional 6 weeks. So do it right the first time, keep these patients safe, keep them alive, and also you can stop them or decrease the likelihood of them developing multi-drug resistant organisms because you have been inefficient. So the book, the website, rn-ivpb.com all show you, or both show you, how to do this properly.